of the criminal justice system. And almost everything that I do as a county commissioner involves our behavioral health partner. I have learned mental and behavioral health is pretty much part of everything, and hopefully we can do that right in our county. So please welcome Brandon Hatch.
Thank you. It's good to be with you. I was in Midway, I think this past October in the fall, something like that, and we spoke about mobile crisis outreach teams, and part of that crisis work that we do involves receiving centers, and there were a number of questions. We decided to talk a little bit more about that today. So let me just begin by showing you some national data on receiving centers or on law enforcement or people with behavioral health issues. And then I'll talk a little bit about our receiving center and what we do, and then give you some data about what we have accomplished in the past year. We've been open for about a year and a half now. And you can see that 50% of those who are arrested typically have a mental illness. And those of you that are familiar with your jails probably see that quite a bit. Probably won't surprise you either that in 44 states in our country that there are more mentally ill people in those jails than there are individuals in the state psychiatric hospitals. Utah is one of those states where your jails have more people with mental illness in them than our state hospital. It takes, when someone is brought to an emergency room with a behavioral health issue, a mental health issue, boarding time, meaning the time it takes someone from going from an emergency room to an inpatient psychiatric bed takes 7 hours. Mostly that's because, you know, you come to an emergency room, you drop somebody off, their family member or law enforcement brings somebody in, and the hospital then is responsible for finding a bed for that individual. Not all hospitals have psychiatric beds. And so if you live in a rural community, that might mean a transport from an ambulance from your hospital into a different county in order to find a bed. The process generally takes about 7 hours. And along the Wasatch Front, our problem tends to be that those psychiatric beds, even though we have a number of hospitals with beds, they're full. And so someone ends up waiting in an emergency room for that service to occur. So that one's a little bit hard to read, but it probably won't surprise you that 21% of all law enforcement time is related to individuals with a mental illness or in transporting that individual. So let's say you know your typical officer works an 8-hour shift. That's probably anywhere from an hour and a half to 2 hours every day that they're spending on someone with a mental illness or a behavioral health issue. And it's a lot of transportation time, right? So that psychiatric boarding piece that I mentioned to you earlier, where someone is waiting in an emergency room to be taken to a hospital in the time that they're there. Recently, here in Davis County, we had an individual in a hospital, an emergency room bed for 5 days waiting to get to a psychiatric unit. The cost to a family member of bringing someone into an emergency room is, you know, pretty expensive. The average cost here along the Wasatch Front is about $2,200 just for the emergency room stay. That doesn't count the psychiatric time that they're there. So the problem, there's a few problems. One is that we have an over-reliance on law enforcement to deal with behavioral health issues. There are excessive wait times for both patients and law enforcement. So one of the complaints that we get from law enforcement is sometimes they'll bring somebody to an emergency room, and while they're there filling out the enormous amount of paperwork at the hospital, the person that they just brought in has seen a crisis worker provided by the hospital and then leaves before the officer does. So spending time in an emergency room or booking someone into jail. Jail is a much faster way to do that, so we see a little bit more of that. Jails are relying on to hold, that shouldn't say medicate, it should say medicate, to hold, medicate, and treat nonviolent mental health individuals and substance use disorders. And then, as you know, when someone leaves the jail, they're just released. There's really very little discharge planning. So are you going to get treatment somewhere? Here's some resources where you get treatment. I set up an appointment for you to go and get some help. That typically doesn't occur in the jail. They're just released, and then you see them come back multiple times. So really about 4 years ago, Chief Tom Ross, who was just here with us, Bountiful Police Chief, and I started having a conversation about doing something a little bit different. And we have formed a coalition. Commissioner Khumalo is on that group. The sheriff is. We started out with 2 local police chiefs, city prosecutors, county prosecutor, a judge. Patty Fox is participating with us in that. Trying to find out a solution about how could we make something different work. And so thanks to our sheriff, and I couldn't say enough good things about Kelly Sparks, he basically freed up some space for us in a building that's adjacent to the jail where we could bring a treatment team in and create a crisis receiving center. I'm going to tell you a little bit more about what that is. It's for people with acute mental health or substance use issues, meaning they're in crisis right now for what's happening. Okay, that's one of the things that we do. I like to look at it as an urgent care for behavioral health, right? That you're not taking them to the hospital, you're not leaving them at home or taking them into an outpatient clinic. This is an emergent care facility that can deal with these kinds of issues, these crisis-related issues. Ours is set up as a pre-booking diversion. And the way that works is an officer, encounters someone with public intoxication, we'll say. And they'll go to that individual and say, listen, I can charge you and take you to jail, or I can take you, if you volunteer, I can take you to a facility where you can get some help, and we'll start engaging you in treatment. And if you choose to do that, we're not going to charge you. We're not going to take you to jail and book you. We're just going to get you some help. Now, that individual has 60 days with us, not in the facility. The facility is typically 23 to 72 hours stay. But we give them 60 days to engage in treatment. All the while, we have our staff, our people, and peers for these individuals reaching out, trying to engage them in treatment. And if they're successful in engaging in treatment, no charges are ever brought. If they leave, walk out the door, never show up for treatment, start ignoring our phone calls, we notify the arresting department, and they can go and charge them, take them to jail. Okay? So it's a pre-booking diversion. So what do we do when someone comes into this facility? Let's say that officer for possession or public intoxication brings somebody in. The first thing that we do is we assess them for suicide. We have a mental health therapist on staff 24/7 who does a mental health and substance use evaluation along with that suicide evaluation. We have a nurse on staff 24/7 who, somebody with intoxication, right, we have to be very careful as they go through withdrawals Are they medically safe to be there? So we do that. We have a peer on staff. Hey, I've been where you are, and I know how I can help you get out of this. Let me show you how it works. And that peer will reach out to them every day after we discharge them from here. Even if they're coming in once a week for treatment, if they're wherever they are, we're reaching out every day for those first 60 days to try to engage. And then if they're in treatment, we will continue to interact with them, call them, how are you doing in treatment? Is it working out for you okay? Are you getting your bills paid, you know, or is there any help that we can provide you with that through treatment? And then when they're done with treatment, hey, we have this recovery community. Why don't you come join us for some activities? Okay, so that's the peer's job. Sticks with somebody through the whole process of treatment. Case management, we do a lot of discharge planning. When you leave our receiving center, you have an appointment set. Your appointment is going to be in 2 days. At this time, you're going to see this person. And we just want to make sure that we don't lose them along the way while they're waiting. As I said, it's generally a 23 to 72 hour stay, but if somebody comes in with alcohol detox, okay, some of them take a little bit longer than that. So we keep them in recliners for the first 23 hours and maybe 48 hours. And then beyond that, you know, we'll put them in a bed. My microphone has died. Oh well. I'll just talk really loud. So we will, if they need to stay a little bit longer to go through that detox process, we will do that. We've had people stay up to 2 weeks in there before, and that's something that we can manage. One of the other things we do is people that come in with, which all of you are familiar with, a heroin misuse, abuse, alcohol, poisoning, those kind of things, we can treat them with medication. So we have a prescriber that comes to our receiving center every morning and sees anybody that came in overnight, prescribes medications. They take the medications while they're there. That helps them get through some of that. And then we continue to see them after they're released in that for opioids and alcohol. And I don't want to give you the idea that this is just a substance use facility. It is not. We get a ton of mental health issues that come in there, brought in by family and police, and you'll see that in some of the data that we have. We can treat some of those mental illnesses with medications as well. So if we need something to happen in the middle of the night, somebody comes in at 3 in the morning, brought in by an officer, we have 24/7 on-call prescribers that can be accessed. Where do the people come from? So about half of the individuals that we have coming in are being brought in by law enforcement. We have a mobile crisis outreach team that also can access this. They're in someone's, oftentimes our crisis team is dispatched by law enforcement. Hey, I've got something going on here with this guy. Can you come help? We will come, officer will leave the scene, and then we are responsible for that individual. And they'll bring them in. Our crisis team will bring them into the receiving center. Our community partners can refer. One of the great things that we have seen is that we're starting now to, in the last 6 months especially, getting at least those that have been in our receiving centers before, family are saying, can we bring our child back to the receiving center? Which is a good sign, right? We want family, and many of you know someone with a mental illness or a substance use problem. I don't want to take them to jail. I don't want to call the police. I don't want to take them to the emergency room. I know how expensive that is. Can I bring them to your facility? We say, absolutely, bring them in. A lot of
we are starting to get a lot of this now, where individuals who have come in for a substance use issue are saying, are now saying, hey, you know, it's the weekend, I've got friends, they're asking me to come, hang out with them, I know it's not a safe situation, I feel like I'm going to relapse, can I come in and spend the night? Absolutely. Eligible offenses. This is more on the law enforcement side. This is a little small, hard to read. Any misdemeanor crime that has a drug nexus or paraphernalia can be brought in. Intoxicated individuals, our only rule on that, we're no refusal. If law enforcement brings them, we take them. Unless that individual cannot walk in under their own power. Sometimes they need a little help, but we'll take them, okay? Any offense that doesn't require restitution, so we get some theft, right, because of their drug issue. We have found this hasn't been as big of an issue as we thought it would be at the beginning. We haven't had as many of these, but we find that a lot of the bigger, like a Walmart, for example, they are not seeking restitution. So those individuals are brought to us. Some of the smaller, you know, stores, they need restitution for what was stolen, and they're often taken to jail. So it really depends on the institution if they're able to, you know, receive restitution or try to go after it. Misdemeanor warrants related to their drug history. Mental illness, anyone showing symptoms, signs, you know, a family member sees it, somebody's not taking their medications, law enforcement comes across somebody's loitering out in front of a store and not acting right, those individuals are brought in. Someone that an officer comes in contact with that says, you know, I'm feeling kind of suicidal, they bring them in. It does not include domestic violence or assaults, although we do tend to get some assaults anyway. And I'll show you some data on that. Not many, but we get some. DUIs, we do not accept those. And if an individual has an injury that needs medical attention first, we ask that they go get cleared by a physician before they come into our facility. We hope to see a decrease in referrals to the jail, decrease in the arrest rate after 6 months, increased use by our community partners, emergency departments. We have emergency departments calling us and saying, hey, I've got somebody here that really shouldn't belong here. Can we have them transported to you? Absolutely. Last year, we had 592 admissions. Yeah.
Out of those 592, how many of those would be what's called frequent flyers? Normally they would just go to jail and now they come.
They're coming.
Been in trouble before with you and that issue.
We get a few of those. So half of these, so roughly 300 are brought in by law enforcement. Of those 300, we had 61 that did not engage in treatment. So there were 20%, which is fantastic, by the way. So 80% of the people that started in the receiving center stayed in treatment, stayed engaged with us somewhere. We haven't had many, I don't have data to tell you how many people have returned, but we have some officers who have said, I'll keep bringing this guy back every time. Because you never know when someone's going to finally engage, when it's finally going to click. So we've had a few, but there's not very many. There's not very many frequent flyers. So referral source. You can see that 47% were brought in by law enforcement, and this pie has really changed in the last 6 months because we have, as more people become aware of our receiving center, the more family members are bringing loved ones in. And so the referral number from self and family has really started to grow. In
fact, in the first quarter of this year, we had more people brought in by family than we did law enforcement, which is a great sign. Because it's a great service to individuals in the community who have loved ones who need help and they don't know what to do. The 5% from the courts is probably something we won't see this next year because of COVID. Drug court was shut down and people would commit a crime or something and were brought in. We ask law enforcement, when they bring somebody in, we ask them to fill out a short survey. What would you have done with this person had the receiving center not been here? And you can see that 47% of them would have ended up in jail. 16% would have been in the emergency room. Those are primarily our mental health folks. 17% would have been allowed to stay home. You know what? Why don't you just go home and sleep it off or whatever. And we get a few that we're not a homeless shelter, but we get a number of people that are homeless commuting along Front Runner from one county down to the next, and Front Runner stops working at late at night and they have to get off and law enforcement's there to pick them up and bring them in. They're transient, but they have a drug issue. Those are a little more difficult for us to deal with, but we try to engage them. We give them a discharge plan. This is where you can go in your own county. We'll see them for anybody from any county, and then try to work them back into treatment somewhere. Potential charges. This is another question we would have asked. We asked the officer when they bring them in. What would you have charged them with had the receiving center not been here? And so you can see that we get a ton of possession and public intoxication, a little bit of assault, some trespass, some theft, some warrants. We actually thought, in meeting with law enforcement when we first started, we thought theft and warrant would be the highest one we would get. And it's not even close. One of the other things that we want to do is make it better for law enforcement. So we want them to come in and be able to get back out on the street. So we ask the officer, how long is it taking you to bring somebody here? And you can see that most of it, 5 minutes. It's a 5-minute drop-off. We give the officer a drink, cup of coffee, a candy bar, and send him on his way, and we just take it from there. We also ask law enforcement, how was your experience of using the receiving center? And you can see that on a scale of 1 to 10, that many of them say, this is great. We love this. We love that you're here and are doing this. It saves me a ton of time. Okay, questions?
This works out pretty good at Davis County. What if you're one of the 20 or so rural counties? What would you suggest that those counties do to somewhat accommodate the problem?
So we have receiving centers in Davis County, one in Utah County now. Washington County is starting one. Salt Lake County is doing the groundbreaking soon. Northeastern Counseling out in the Uinta Basin is going to try one. Now, we don't know how it's going to work. It'll probably look a lot different than mine. Utah County's looks a lot different than mine, and so will Washington. Having an officer have to transport long distances to get to a receiving center is a problem. I believe that there are ways of making it happen in a smaller community. If the community has, or the mental health provider has a facility where they're open 24/7, or it could be even a hospital that has space for you to provide these services. It doesn't have to be at the same level of staffing that we have here, but it could be done in smaller communities. And we'll be really interested to see how this works out in the Uinta Basin. I believe that receiving center is going to go in Roosevelt, and then people will be brought there. I don't know how it'll work for law enforcement.
It'll be about an hour and a half for the longest drive, which will be Daggett County,
Yeah. So there is funding, there is state funding for this. We don't charge the individual anything to be there, but if they're insured, we'll bill their insurance. If they're Medicaid, which in our county, probably 50% of them have been. In other counties, it's probably much higher. There is a bundled rate that helps from Medicaid that helps pay for a day rate there that helps pay for the service. There are ways to, there is funding available to make this happen. Certainly along the Wasatch Front, but in rural communities, if this works in Uinta Basin, we'll have funding that can go into other communities as well.
Right.
Okay, yes?
My hand up.
Yes.
I'm from the most rural area. Sounds good, but we don't have a law enforcement. We don't have the service. Nothing.
So San Juan Counseling,
How do you see planting the seed down there?
well, I think it has to start.
State funding, on the other hand, says we have to stop at the borderline.
For
And I'm going
Medicaid.
to Navajo Nation.
Okay.
So those are the China Wall or the,
What you do have access to is San Juan Counseling. And it would be a relationship that you'll have to work with them on to say, listen, we would like to do something like this and see if it can be started on a small basis. I think something like this can be done on a small scale.
we have over 100 miles, whether you're talking about distance, getting services, law enforcement officer. Emergency, they are sporadically available, yeah.
Yeah, and that will be the challenge, right? But remember, it's not just for law enforcement. It could be for family or friends or other community partners that can bring
Yeah.
people in too. That would be
I
helpful.
understand that.
Okay.
But the other question I have or consideration is the prison. Sometimes the prisons are labeled correction centers. And I ask police officers sometimes and says, how many individuals have you corrected? None. So there's a crime which is a problem, and the community is impacted, and the jails or holding cells are the answer for decades.
Right.
Just recently, I guess you're playing off the federal government's initiative to, hey, we can't just jail them. We have to provide behavioral health, mental health treatment.
Right.
That's
And
the concept.
some will never engage in treatment, or it's going to take them a long time. But sometimes corrections helps scare somebody into treatment, but we really need them to engage on
But
their own.
those are small
It's going to take
numbers.
some time.
Those
Yeah.
are, so I've worked in the treatment center. I've directed a treatment center. Now how they behave. So
Yeah.
I'm talking from that perspective. And
It's a
the
challenge.
system is there, but you don't have the service immediately available. Do you, how much of immediate family do you involve as time goes on? Individuals, families, your children, if there's any community, because community is where you need to hit.
I
And
agree.
I've been trying.
I agree. I'm going to move on. There's a few more questions.
I have a few questions to tie together. What's your annual budget? What percentage of that is paid for by these billings to Medicaid or private insurance? And then, how many annual intakes can you handle a year, let's say?
Okay. So
For that money.
let me start at the end. So the number of people we can handle, we think we can handle about 15 people per day coming in with our staffing level that we have. Our annual cost to run a program, this one was just a little north of 1 million to run.
That's operation.
Operations, yes. Facility and operations. And our revenue collected from insurance and things like that was about $400,000. The rest of it came through state and federal funding.
So really no cost to the county?
No cost to the county. Zero cost to the county.
Should we do one or two more questions and then we're ready for lunch?
Sure, and then Mike, you can always email me and I'll help you.
I just wondered, how do you educate the community, the center here? I mean, if I got a brother I'm gonna take to the ER, how do I know if your service is available?
Yeah, and for us, we've educated the ER to start with, and they'll call us. It's a good question, though. We haven't gone out and said, we haven't put billboards out there or anything like that to educate people. It's been word of mouth, and it's, like I said, it's been 1.5 years that we've been open, and that word of mouth is just now starting to spread, and we're seeing more people come in like that. Law enforcement has been great about helping spread that word for us as well. Officers going into the community, you know, those that they do let remain at home, hey, here's some information, here's a piece of paper that has information about this place that you can go next time this happens.
One more?
So where your charts show that families take loved ones in almost as much as law enforcement, like we're in Iron County, when Washington County builds their treatment center, could we use that? Could we have a family take a family member down? And could law enforcement, where it's logistically hard to do that, could law enforcement turn it over to a family to take it over?
Yes, absolutely.
Is that available to Iron County, to use Washington County?
It will be, yeah. Southwest Behavioral Health will be doing that, and I know they're your provider. And so I anticipate once they open, now Washington County wants to build a big facility to do this, and it's going to take them a little bit of time to get that up and going. So Southwest Behavioral Health is trying to get that started on a smaller scale right now. I anticipate sometime this summer in Washington County, and they'll take people from the 5 counties that they serve.
Yeah, we talked about this, but this is the...
Yeah.
So when you say there's state funding for this, what department, how do they fund?
So the funding would come through the local behavioral health authority. For some of you, that's the counties. But it'd have to be something that the local authority would request.
From the state?
From the Division of Substance Use and Mental Health.
And they're Weber, so is it Bear River? No.
Weber does not have one yet. They're working on, they're doing something a little bit different, but you know, not just yet. So the funding is there. We're just trying to see if we can make, you know, what we have work for everybody to spread it out. We'll just see how it works in rural communities. Yes?
I think you can use some of the JRI money.
JRI money is a great resource, great funding source to do a receiving center on a smaller scale for sure. Okay, one other question over here. Hey.
Quick question. What is the expectation for the locals by taking the money from the state? What do they want in return?
What does the state want in return?
Yeah, data, is there expectations around
There-
facility, or setting up?
There's some data. They have requirements about how you staff it. Although in rural communities, I would think that they're going to have to be more flexible on that, more on-call kinds of things. But there will be there's some data points that we have to submit, but it's not like everything else. This is not too bad.
Yeah.
Well,
Thank you, everybody.
let's thank Brandon and